I cut into my own skin in a motel bathroom because the urgent care doctor laughed at me. Not because I wanted proof, not because I was curious, because no one else believed me when I said my body was moving on its own. He didn't laugh like a villain. He laughed like a tired man who'd seen too many anxious people with Google symptoms and too little patience left for one more.
Looks like bites. Benadryl, hydrocortisone. Try not to scratch.
He was already turning toward the door. I told him it moved. He paused with one hand on the handle, half looking back like I'd said something unserious, something familiar.
Skin can do that when it's inflamed.
It moved, I repeated. My voice cracked the way it does when you're trying to sound calm, but your body has already decided panic is rational. He glanced at my forearm, the swollen red knot just below the elbow, the small dark pore at its center, like a puncture, like a tiny mouth.
Okay, get some sleep.
And then he left. An hour later, I stood barefoot on cold tile with a cheap plastic razor in my trembling hand, staring at the lump like it was staring back. I told myself I was being responsible. I told myself I was preventing an infection. I told myself I still had control. Then I pressed the razor down and felt the first sting of my own stupidity. Chapter 1. Check your skin. If you're listening to this like a story, stop right now and check your skin. I'm serious. Check your arms, your calves, the back of your neck, anywhere you've had a bug bite that didn't calm down the way it should. I used to be normal about bugs. I camped, I fished, I didn't panic over a mosquito bite. I'm not delicate, I'm not a hypochondriac. I work construction, renovations mostly. When you do that, you get scratches and bruises you can't place, and you learn to ignore your body until it gets loud. My body got loud on a Monday. It started as itchiness, a strip of heat along my forearm, like I'd brushed against something sharp and living. I looked down and saw 3 raised bumps in a line. Spider, I figured, or a strange ant. That's what I told myself driving back from a job site outside Missoula. That's what I told myself when I stopped at a gas station, washed my hands, and stared at my arm under fluorescent light. The bumps had dark centers, not like scabs, like pores. I pressed one gently with my thumbnail. It didn't hurt much. But something beneath the skin shifted. Not a twitch, not a muscle, a small, deliberate push, like something rolling where it shouldn't have room to roll. I pulled my hand back so fast I splashed soap across the sink. A man beside me glanced over, then looked away, the way people do when they don't want to be involved. I drove the next 3 hours with the windows down. Not because of the heat, because I kept imagining a smell I couldn't actually smell. Sweet, rotten, like meat left too long in the sun. It wasn't in the truck, it was in my head, or it was in my arm. Chapter 2. The Motel. I didn't go home. That part matters, because if I'd gone home, my sister would have forced me to the ER. Because if I'd gone home, my dog would have pawed at my arm and whined the way he does when something's wrong. Because if I'd gone home, I would have been surrounded by familiar things that might have anchored me. Instead, I stopped at a roadside motel off the highway. One of those places with a buzzing neon sign and doors that open straight to the parking lot. The kind of place you choose when you want to disappear for a night. I checked in under my real name. I wasn't trying to be dramatic. I just wanted a shower and 8 hours of sleep. The woman at the front desk glanced at my arm when I handed her my ID.
Bugs?
Something like that.
Don't scratch. They get worse when you scratch.
She slid the key card across the counter like she'd said it before, like she'd said it a lot. I almost asked her what gets worse. I almost asked her if it happened to other people. But the itch turned into pressure, and pressure makes you stupid. Pressure makes you want silence, distance, and a locked door. Inside the room, I dropped my bag on the bed and went straight to the bathroom mirror. The bumps were bigger now. Not much, just enough that I could see them without leaning close. 3 raised knots with dark pinprick centers, and a 4th one, new, closer to my wrist. I pressed around the first bump the way you test a bruise. The skin was hot, the flesh underneath felt wrong, thicker than it should have been. I pressed a little harder. The dark center widened slightly, and something beneath my skin pressed back. Not a twitch, not a spasm, not imagination. A small, deliberate response, like something acknowledging me. I stepped back until my shoulders hit the bathroom door. My first thought wasn't parasite. My first thought was that I was having a stroke. Because adult fear doesn't jump to monsters. It goes to the most socially acceptable explanation first. I grabbed my phone and searched. Bug bite moving under skin, swelling with central pore, movement beneath the surface. The results loaded. I won't describe them. I don't have to. Once you see the words, your brain does the rest on its own. Medical terms, images I wish I hadn't seen, explanations that used the word infestation without flinching. My stomach tightened hard enough that I thought I might throw up. I leaned over the sink and breathed slowly through my nose. The air smelled like motel cleaner and old water. My arm didn't itch anymore. It pulsed. I shut my phone off because it's one thing to read a word on a screen. It's another thing to realize that word might be inside you. Chapter 3, Urgent Care. I drove to urgent care because the ER felt like too much. The ER was for heart attacks and gunshots. The ER meant bright lights and plastic chairs and people watching you scratch your arm like you'd lost control. Urgent care was clean, quick, polite. Urgent care would give me antibiotics and reassurance. Urgent care would make it normal. A young nurse took my vitals and glanced at my arm.
Been camping?
Fishing trip, a couple weeks ago.
Any fever?
Not that I know of.
Any drainage?
No. She looked at the bumps again, leaned in close, then leaned back slightly, like she'd noticed something she didn't want to think about.
Doctor will be in soon.
The doctor was older, his stomach pressed against his white coat. His eyes looked tired before he even looked at me. He glanced at my arm and touched one bump lightly with the end of a pen.
Bites.
Something inside me snapped, quietly, like a thread giving way. No, it moved. He sighed, already annoyed.
Itching can feel like movement.
Not itching. My voice got louder before I noticed it. Something pushed back. Something... He raised a hand.
I'm going to prescribe a cream and an antihistamine. If it gets worse or you develop a fever, go to the ER.
Can you... I swallowed. Can you open it? Just check. For a second, his eyes stayed on my face. I saw him make a decision. Then he made the easier one.
No, that would be unnecessary trauma. These things resolve.
I stared at him. Resolve into what? I didn't mean for it to sound sharp. Sarcasm just found me before anything else could. He didn't answer. That's when he laughed. Not loudly, not cruelly. The kind of laugh that sounds like a door closing. An hour later, I was back in the motel bathroom with a razor in my hand. Because if no one else was going to treat me like I was real, I was going to have to prove it to myself. Chapter 4. The First Cut. The first cut was shallow. I'm not brave. I'm not built for pain. I was just more afraid of not knowing than I was of hurting myself. I cleaned the skin with alcohol from a small first aid kit I kept in my truck. The sting made my eyes water. I told myself that was good, that it meant I was doing it right. I held the razor the way I'd seen doctors do it in videos. Careful, precise. I drew a short line across the bump. Blood surfaced immediately. The swelling didn't change. I pressed around it, trying to force whatever was inside toward the opening, the way you work a splinter loose. Nothing happened. I pressed harder. The dark center widened, and something beneath the skin reacted. For a moment, I thought I was imagining it, that my brain was filling in the blanks. Then something pale shifted just under the surface. Not fast, not violent, intentional. My stomach dropped. I leaned closer to the mirror, breathing through my teeth. The swelling pulsed beneath my fingers, not in time with my heartbeat, its own rhythm. I squeezed again. Whatever it was moved closer, then retreated like it didn't like the light. I whispered without meaning to, "Get out." I grabbed a pair of tweezers from the kit. My hands shook so badly I dropped them once. When I clamped down and pulled, it resisted. Not the way skin resists, the way something alive does when it wants to stay where it is. Pain flared sharp and deep, different from the cut. I heard a sound I didn't recognize at first. Then I realized it was coming from me. Whatever I pulled free dropped into the sink. I didn't look right away. When I did, it moved. Small, pale, wrong. It curled slowly, like it was trying to find its way back. I slapped my hand over it without thinking. It twisted beneath my palm, strong for something so small. I crushed it. I don't want to describe how that felt. I turned on the cold water and watched what was left disappear down the drain. Then I looked back at my arm. The swelling was still there, smaller but not gone. And beside the cut, another dark spot had begun to form, like the skin was preparing a new opening. That's when I understood. I hadn't removed it. I'd removed one. My legs gave out. I sat on the toilet lid, holding my arm away from my body like it belonged to someone else. My phone was on the counter. After a moment, I picked it up and called the ER. Chapter 5. The ER. The ER waiting room smelled like bleach, sweat, and fear. A muted daytime talk show flickered on the TV in the corner. A man with a bandaged hand stared at the floor. A mother bounced a crying toddler on her knee. I walked to the desk and held out my arm. I have something under my skin. I pulled one out. The triage nurse's expression changed. Not disbelief, recognition. She took my name, my insurance, my vitals. She asked about travel, about being outdoors, about animals. Then she leaned closer and used a small light to look at my arm. I saw her swallow.
Okay, we're going to take you back.
Back. Not have a seat. Not you can wait. Back. That should have reassured me. It didn't. Because when medical professionals stop treating you like an inconvenience, it means your problem has become real enough to respect. They put me in a curtained room and told me to rest my arm on a pillow. A young resident came in. His eyes were alert. His face was controlled in a way that felt practiced.
What happened?
I told him everything. Fishing trip, the bumps, the movement, urgent care, the motel bathroom, the razor. He didn't react to the razor, didn't judge me, didn't laugh. He nodded like every detail mattered. Then he unwrapped the gauze from my forearm. The swelling had spread. There were 7 bumps now, a line that climbed toward my upper arm. Cold washed over me. Sweat prickled my scalp. They multiply fast. He looked at me over the edge of his mask.
No, they migrate.
My mouth went dry. They move. He nodded. Then he did something small and terrifying. He turned off the overhead light and switched on a brighter one, aiming it directly at my arm. The pores reacted. One of them widened slightly. The skin around it shifted as if something beneath it didn't like being seen. Farther up my arm, 2 of the bumps changed position. Not dramatically, just enough, a subtle adjustment. Something inside me was repositioning itself. The resident exhaled slowly.
We're going to get imaging.
He stepped out through the curtain. That's when I heard the scream. It came from somewhere down the hall. High, sharp, then it stopped. The hospital returned to its steady noise, like the sound had never existed. My heart hammered. I stared at my arm and tried not to imagine other people, other rooms, other bodies learning the same truth. My phone buzzed. A message from my sister. "You okay? You make it home?" I didn't reply, because how do you text someone that you're full of things that are learning how to move without turning into a story they laugh about later?
Chapter 6. Imaging. They started with an ultrasound. A technician rolled in a cart and spoke softly, like kindness could make the truth easier to look at. She spread gel on my arm and pressed the probe down. The screen filled with gray static, shadows, movement that didn't mean anything at first. Then something separated itself from the noise, a dense shape, oval, slowly shifting. Then another, then a third. I watched my own body on a monitor and understood what it meant to be inhabited. The technician's mouth tightened. "Can you tell me what you're seeing?" She hesitated.
I'm not allowed to interpret. The doctor will talk to you.
She didn't need to interpret. My eyes could do that on their own. Next came a CT scan. More waiting. More cold rooms. At some point, a nurse gave me something for anxiety. It softened the edges, but it didn't touch the center. Nothing touches the center when the center is this. There are things living inside you. When the attending physician finally came in, I knew before he spoke that my life had just split into 2 parts. Before this room and everything after. He was older, serious eyes. He sat on the stool like this wasn't his first time having this conversation, but never his favorite.
You have a parasitic infestation.
The words landed cleanly, too cleanly.
It appears to be a type of fly larva.
My throat worked. How many? He glanced at the chart.
We can see at least 12 in your left arm, possibly more.
12. My mind tried to understand the number by turning it into harmless things. Eggs in a carton, months in a year, people around a table. Then it placed them under my skin, and everything went distant. They're all in my arm. He looked at me steadily.
Not necessarily.
The word hung there.
We don't see them elsewhere yet, but you mentioned symptoms involving your ear.
My hand moved there without thinking. Yes, he nodded once.
We'll need to examine that, and we'll need to remove what's in your arm surgically.
Surgically, the word felt unreal in my mouth.
Do not attempt to remove any more on your own.
I almost laughed. The motel bathroom, the razor, the idea that I'd been brave instead of reckless. How did this even happen? He paused.
Exposure outdoors, certain environments. It's uncommon here, but not impossible.
Uncommon, but not impossible. That's the phrase adults use when they can't promise you safety. Am I going to die? The question didn't sound like it belonged to me.
Not if we treat it, but left alone, it can cause serious complications.
My imagination did the rest. I pictured my body failing quietly. I pictured waking up to movement where there shouldn't be any. The doctor stood.
We're going to take care of you.
Then, softer, like he knew exactly what I was holding on to.
This is real. You're not imagining it.
That should have been comforting. It wasn't, because now the horror had a name, a code, a place in a system that already knew what to do with me. And I was still the one who had to live inside my body.
Chapter 7. The Procedure. They wheeled me into a procedure room. Bright lights, stainless steel, instruments arranged with a quiet precision that felt like a promise and a threat at the same time. A nurse shaved my forearm and scrubbed it with antiseptic. The smell was sharp and clinical, the smell of a body being turned into a task. They injected a local anesthetic, a brief burn, then numbness. A surgeon entered, calm hands, a steady voice.
We'll make small incisions and remove them. You may feel pressure.
Pressure, like that word could cover what was about to happen. I stared at the ceiling and focused on the tiles. Then I felt the first incision. Not pain, something worse, a tugging sensation, a pulling deep inside my arm. The nurse spoke softly near my head, reminding me to breathe. The surgeon murmured to someone beside him.
Got one.
The words landed casually, like he was checking items off a list. Then again. Got another. And again. The worst part wasn't imagining what he was removing. The worst part was the rhythm. Regular, methodical, like harvesting, like my body was a place things grew. At some point, I turned my head. I shouldn't have. On the tray beside me were small, pale shapes arranged carefully. Some of them moved, slowly, weakly, like they were trying to remember where they belonged. My stomach lurched. The nurse stepped into my line of sight and held a basin close.
You're okay.
Her voice didn't quite believe it. The surgeon kept working. Another incision. Then he stopped. His hand stayed on my arm. Hold on. The room felt suddenly smaller.
This one's deeper.
What does that mean? He didn't answer. He pressed gently around the swelling. I felt something shift. Not pain, movement. Slow, deliberate, under my bicep. Somewhere it shouldn't have reached yet. Oh my God. The words slipped out before I could stop them. The surgeon's voice stayed calm.
We're going to give you a little more sedation. You're doing fine.
I wanted to scream that I wasn't fine, that nothing about this was fine.
but the medication flowed in. The edges of the room softened, the lights blurred. The last clear thing I heard before everything drifted was the surgeon speaking quietly to someone near him.
There's a track they've been traveling.
And then my mind folded in on itself.
Chapter 8. Most. I woke up to a different sensation. Not itching, not pressure, a hollow ache, like the inside of my arm had been emptied out. My forearm was wrapped in thick bandages. My hand was swollen from IV fluids. My mouth tasted like metal. A nurse checked my monitor and smiled at me. The kind of smile meant to be reassuring.
You're awake.
Did you get them? My voice barely worked. She hesitated, just long enough.
We removed most.
Most. The word opened a drop inside my chest. Most. She left to get the doctor. I stared at my arm and tried not to think, but thinking wasn't optional anymore. Thinking crawled. My ear began to itch, not a surface itch, not something you can scratch away, something deep, internal. I lifted my hand and touched my ear gently. My fingers came back damp. I looked at them. Blood. Cold spread through my stomach. The nurse returned with the attending physician and an ENT specialist. The ENT was small, precise, focused eyes, a lighted scope already in her hand.
We're going to look in your ear. Try to stay still.
I wanted to run. Instead, I lay there and did what I was told. She inserted the scope. Her expression changed. Not panic, professional concentration tightening.
There's inflammation and debris.
Debris. She reached for forceps. I felt a pull deep inside my ear, a pressure like something being drawn out of my head. She stopped.
I'm going to need suction.
The sound filled the room, wet, mechanical. I stared at the ceiling, my eyes watered, my hands clenched the sheet. When she finished, she withdrew the scope and looked into a small dish. Then she looked at me.
We found larvae in your ear canal.
My throat closed. How many? She waited before answering.
Several. We need to make sure none migrated deeper.
Migrated deeper. She nodded.
That explains the itching and bleeding. We're going to treat aggressively. You're in the right place.
The right place. But my mind wasn't in any place at all. It felt like it had stepped outside my body and was watching it from a distance. I thought of the motel mirror, the pore opening like a mouth. I thought of my hand crushing something in the sink. I thought of the line of bumps climbing my arm like a map. And then a worse thought arrived. How long had it been inside me before I noticed? How many days had I worked and driven and slept while my body was being used? How many nights had I been warm housing for something that didn't need me for anything but meat? Chapter 9. Observation. They kept me in the hospital for observation. They gave me medication. They ran blood tests. They checked my temperature. They watched me like I might change into something else. And in a way, I already had. Because once you understand that your skin can be entered like a house, you never feel completely alone inside it again. The first night after surgery, I woke suddenly convinced something was moving in my leg. I kicked the blankets off and clawed at my calf until a nurse rushed in and caught my wrists.
It's okay. You're safe. It's anxiety.
Anxiety. That word makes it sound like my body was exaggerating. My body wasn't exaggerating. My body was remembering. The next morning, a social worker came to talk to me about trauma responses. She had kind eyes, a careful voice. She asked if I had anyone. I told her my sister would come. I didn't tell her I was afraid to be alone with my thoughts, because my thoughts had learned something new. They could imitate sensation, an itch with no source, a movement that might be real or might be memory replaying itself. On the third day, the attending physician came to discharge me. My arm was healing, my ear looked better, my labs were stable.
You're lucky you came in when you did.
I looked at him. I came in after I cut myself. He nodded.
Still, some people wait. They ignore it. They scratch. They get infected. You came in.
I wanted to laugh, not because it was funny, because my fear didn't have anywhere else to go. I came in because something under my skin responded when I touched it. I came in because I couldn't pretend I was alone inside myself anymore. Instead, I nodded. I signed the papers. Chapter 10. Home. My sister picked me up. She hugged me the way people do when they're checking that you're still solid, that you haven't become something fragile without them noticing. She didn't look at my bandages. She didn't ask questions in the car. Halfway home, stopped at a red light, she spoke quietly.
Are you okay?
I almost said yes. That's what men do. We say yes until the moment we can't. Instead, I said something truer. I don't know. She reached over and squeezed my uninjured hand. We drove the rest of the way in silence. At home, she made soup. My dog sniffed my arm and whimpered, then pressed his nose against my leg like he was trying to claim me back. That night, I slept in my own bed. I should have felt safe. Instead, I woke at 3:12, the same time as the first night in the rental. I lay still, staring at the ceiling while my heart counted seconds. Slowly, I turned my head and looked at my arm. Bandages, clean, still. Then I felt it. Not a sound, a sensation. A small, familiar pressure beneath the skin, just above the edge of the bandage, like a knuckle pressing gently from the inside. I froze so completely, my muscles cramped. I waited, holding my breath. Nothing. I told myself it was a muscle spasm, a nerve misfiring, healing tissue doing something strange. I told myself that because the alternative was unacceptable. Then it happened again, a deliberate tap, patient, like something knocking, like something inside me had noticed I was home and wanted to remind me of something. You didn't get us all. I sat up so fast the room tilted. My dog jumped off the bed and began to whine, circling me. My hands shook as I pulled at the bandage, unraveling it until the skin beneath was exposed. At the edge of the incision line was a new bump, small, fresh, a tiny dark pore at its center. I stared at it until my eyes burned. Then, right in front of me, the pore widened slightly, as if the skin itself was breathing. Something pale rose just enough to be seen. Careful, testing. I didn't scream. I didn't cry. I didn't run. I reached for my phone with a calm that felt like shock. I took a photo because this time I wasn't going to let anyone tell me I was imagining it. Then I called 911. The second surgery took longer. They found fewer. That was supposed to be good news. It didn't feel like good news. Good news would be never having to learn that your body can be turned into a habitat. Good news would be forgetting the sensation of something living under your skin. I still check my arms every morning. I still shine a light into my ears sometimes just to see. I still wake up at 03:12 some nights, heart racing, convinced I can feel something shift inside me. The doctors say that's trauma. They say the body remembers. Maybe. Or maybe the body remembers because it's still waiting for the day it feels that small, polite knock again. A knock from the inside, a reminder that nature doesn't need permission. It only needs time.